Hello and welcome once again to Moorgate Andrology. And in today's video, we're going to ask a question. What is penile enlargement surgery? What is penile enlargement surgery? So in the past, I would say 10 years, penile enlargement surgery has become really popular in the UK. It's been around much longer than that, but with the increase and interest in cosmetic surgery generally for men, penile enlargement surgery has also become extremely popular at the same time, particularly in the last 5 years, I would say. Now, there are two parts to penile enlargement surgery. The first part is increasing the penile length. You can actually make your penis longer. And in the second part of penile enlargement surgery, there's making the penis thicker. Now, at Moorgate Andrology, I would say a good 90% of patients will have their penis lengthened and thickened at the same time. But patients can have their penis just lengthened or just thickened, if that's what they want to have. So penile enlargement surgery makes the penis bigger. It makes it bigger, flaccid and erect in terms of girth, and longer just in the flaccid length. So when it comes to the length, it's not possible to make the penis longer when it's erect. There are other mechanisms we use to do that after the surgery. But in terms of surgery, it's about making the penis longer when it's flaccid. How do we do that? Well, we cut a ligament called a suspensory ligament. And the function of this ligament is to keep the penis upright when it's erect. And by cutting the midline of the ligament and leaving the two lateral parts intact, we're able to keep the penis upright, but also to lengthen the flaccid length. And this is done when the ligament is cut. It slides the penis forward and increases its flaccid length between 1 to 2 inches. Now, the results of this lengthening surgery are quite predictable. We know that in 95% of men, they're going to get an extra 1 to 2 inches. 5% will either get a bit less than 1 or a bit more than 2, but for most, the results are very predictable. To thicken it, we use your own body fat. So fat is taken usually from your tummy or your thighs, and it's put through a purification system to remove debris such as oils and blood from the fat, and then it's injected underneath the surface of the penis to thicken it. Now, initially, you will get some absorption of this fat. This is normal. About 30% of the fat will absorb, but the urologists allow for that in the amount of fat that's transferred. And the remaining fat, providing you don't lose a significant amount of weight, will always be there. So fat transfer is a permanent answer to thickening your penis. And as I say, most men tend to have their penis lengthened and thickened at the same time. So penile enlargement surgery is done under general anesthetic. You're asleep when you have it done, but it's quite a short procedure. It only takes about 1 hour, that's all. And at Moorgate Andrology, when you come to have penile enlargement surgery with us, you can go home on the same day. Because it's a short procedure, it just takes 1 hour, you're able to go home later the same day, typically after a recovery of about 2 to 3 hours. You're kept in the hospital for 2 to 3 hours, and then you're able to go home. Now, penile enlargement surgery in the United Kingdom is usually performed by a specialist doctor called a urologist. And a urologist has the knowledge, the expertise in terms of male genital surgery, and has a deep understanding, of course, of the male genital anatomy. So if you're looking to have penile enlargement surgery, then make sure you seek out a fully qualified urologist for your procedure. So that's all. So I hope that's answered what is a penile enlargement surgery for you. If you're interested in finding out more about penile enlargement surgery, then please do get in touch with us here at Moorgate Andrology. We're always happy to see you and talk to you about the procedures we perform, including penis enlargement. So that's all from me today. I'll see you next time here at Moorgate. Until then, bye for now.